Hi, folks. I'm Bob Schrupp, physical therapist.
Brad Heineck, physical
Together,
therapist.
we are the most famous physical therapists on the internet.
In our opinion, of course.
Today, Brad,
Bob.
we're going to talk about 12 neck pain self-treatments that work surprisingly well. We've done many of these before, but we're going to add some in today to, keep things spiced.
Right.
Spicy,
Well,
right?
we've got to keep things moving and refresh.
It's like a
things.
marriage, right? You have to do new things to help keep it fresh.
Right, but this is a little easier.
All right. By the way, if you are new to our channel, please take a second to subscribe to us. We provide videos how to stay healthy, fit, pain-free, and we upload every day, trying to keeping it real. And also, if you haven't yet gone over to Facebook, what are you thinking? Why haven't you gone over to Facebook and liked us? Brad and I, we have severe problems here. Brad and I were not liked as children, and now we're trying to turn things around. So.
Well, it's working too, Bob.
All right.
We just got a new friend yesterday. No, today.
Today, yeah, we did a video with him. All right, let's start off with the first one, Brad. This is just a real simple massage, especially good for people who are working at the computer a lot. Let's get, do you want to turn that way too, Brad?
Yep.
We both kind of face the other way. So,
We
be
should
higher than you.
switch.
Yeah, we should switch.
Yeah, here, you go on that one, and I can.
Now we'll be the same height.
Yep.
So you're just going to take your hands, and you're going to put your fingers together, and you're going to pull apart like this. This is just a spleen massage.
So we're just right below the occipital bone, so that the bony part right here, and you go down until you feel a muscle, and that muscle, that soft muscle spot, is where you're going to work. And if some people, that muscle may be tight and may not feel so soft, and we want to get it to soften up.
Yeah, and it's a good, make sure that you're really in good posture while you're doing this. And then you're going to go ahead and do circles, going all the way down. Going all the way out to the side. Circle, circle, circle.
Yep, let's get those muscles to loosen up, get that circulation, get that pressure off those occipital nerves.
Really good for people who are having headaches, because you want to get more blood flow to the brain and to that area if you're having that. We're doing a whole video on headaches. We'll have to talk about that at that time. All right, the next one, Brad, this is a new one we've never done before. You can grab this way, you can kind of grab the neck, and you're going to turn towards the hand. So as you can see with Brad, what he's doing there, you're kind of massaging along the neck as you turn. And you pull real hard like that.
So you're dragging.
You're dragging the fingers. So I'm going this way and I'm doing the same thing. It's just a really good relaxing reduction of pain here.
Right.
Releasing is what I was trying to say.
A lot of R's in there,
Yeah,
Bob.
releasing.
Arr.
We're trying to release the muscle.
I'm going to do the other side, Bob, so I can balance off.
All right, this actually does feel really good. I'm loosening up here. The next one, we couldn't get by without doing a video like this without doing some chin tucks. I mean, you got to have chin tucks in your life. You spend a lot of time head forward like this. You got to work on getting your chin tucked back. Again, you're not going down. You're not going up. You're just going back.
Straight back.
And make sure, I always like to even add a little overpressure a lot of times on these, as long as it's pain-free. So a lot of times you can take your fingers and push it like this, or you can take kind of the crook of your hand here and go back like this and just give it a little stretch.
Yeah, you don't have to push real hard. Just kind of a gentle push is more than adequate.
All right, the next one, this is kind of a new one too. We got the spine over here, Brad.
Oh, yes, we got this spine.
Why don't you come up here with me, Brad?
Oh, yeah.
Lonnie only lets us so close. How far can we come, Lonnie? That's good? No farther than that, she says, Buster. We don't need you here. So this is oriented the same way that Brad is right here. And what we're going to do is you're going to grab onto one of these little bones right here. These are the spinous processes. They're the bones on the back of your neck. And you're going to kind of pull it. And a lot of times, Brad, it's actually good to kind of pull it in an upward direction a little bit. Because
this way.
Yeah, exactly. Kind of an angle going this way. And while he pulls, he's going to turn, and it's just going to facilitate the turning. And it's going to give a little what we call manual therapy to the neck. You're actually trying to move an individual joint. So you can go along and grab each one of these bones. Grab the bone, turn, grab the bone, turn, grab the bone, turn. Again, kind of pulling up in that direction. Why don't you do the other direction, Brad?
Okay. So I like to do my middle finger and my ring finger are the two that I feel the strongest. And those where there's always that big bump. Okay,
yeah, that's C7.
Right, so
that's the seventh one.
Right above that.
That's a good one to start with sometimes, actually.
Well, it's easy to grab. You're on it.
Yeah.
Good practice one.
And let's emphasize with this, Brad, no pain whatsoever. It should feel good to do it. If it
Right.
doesn't feel good, you're not doing it.
Good
But
point.
it's really a cool one to do quite often. Sometimes you can kind of almost manipulate your own bones, and it can actually give you some pain relief when nothing else will. So I have often seen a delayed effect in this one, Brad. I've seen
Okay.
like I do it one day and it feels better the next day.
Sure, yep.
It doesn't always like I do it and I'm like, oh, did that even help? But then all of a sudden the next day the pain's gone, so I'm thinking it did.
I know when I do it on patients, if they have problems looking behind their shoulder, like when you're driving, you know, I'll have them look and then I'll do this to them. And typically you'll gain 5 to 10 degrees
Yeah.
with that extra. And they'll notice the range of motion.
So yeah, they'll
improvement.
start off like this, and then you do this, you're moving it, and all of a sudden they're going like this. They're
Right.
going a little bit further. So, all right, let's go into the next one, Brad. Neck extensions. So these two we've showed many times, but you're going to start working on kind of get your neck in the right position first. So you might do a couple of chin tucks,
With a good posture.
and then you're going to work on bringing your neck back like this. Now, this is one that quite often we find on people who have neck pain, it hurts to do it.
Right.
They'll go out and
You don't want to do it if it hurts. If it's making it worse, you stop right away.
yeah, you're not accomplishing anything if it makes the pain worse. So you do one of two things. One, you might go up to the pain and stop and just work it. But eventually you're going to do is try a towel.
Sure.
So a good length towel, and there's a couple of ways to do this. Why don't
Right.
you show one way, Brad, first?
I'll roll it up like this a lot of times so it's a little thicker. You got a nice round area and get that low on your neck and just hold here for support. And just that little bit of support, almost every one of my patients I work with say, oh, wow, that feels a lot better. And they can go back farther with no pain. And then when you do come up, dump into the pain, you can use the towel to pull forward and it just makes everything easier and improves the whole stretch.
An alternative method to doing that one is you're actually going to use the edge of the towel called the selvage. Selvage?
Yeah, it's a good thing we're not English majors or
Yeah.
trying to be because we would have a tough time getting good grades. But someone always comments and corrects us on that if we don't get it right. So we
you gotta
appreciate that.
bring the towel up like this and fold it up onto your shoulder. The reason this one works a little bit differently is you can kind of hit different levels of the neck.
Right.
So you can start kind of lower and kind of focus on that side. You make what we call like little bunny ears, and the bunny ears stay with your eyes. So I'm watching the bunny ears as they go up. So when my neck goes up, so I'm not going up like this. I'm going up, the towel is going with me.
Let me try that, Bob.
So the key, by the way, is to always try to get more and more motion. Generally, what we find is like if you start off and you're like this far, if you get this far, generally that coincides with less pain.
Right.
Generally, the more motion, less pain.
So don't force it. Don't think if you force it and you get more motion, there's going to be less pain. This should be, that's why we use
Yeah.
the towels, is to do it without pain and gain motion.
Right. And eventually, what we hope always with is people do it with the towel for a while, then I have them come back and I go, try it without the towel now. And they go, oh, I could do it without the towel and it doesn't hurt. So let's go into rotations, Brad. Let's go. One you can just try, again, good posture, and you can just try turning the neck as far as you can go. And if you want to give a little extra overpressure, you can grab here and the back of the head here and give it a little twist.
Oh, yeah.
Again, pain-free, should be pain-free.
Smile
Or
on
I'm
the
trying
face.
the other direction, pain-free. Now, if this one is giving you trouble, what do? Brad? We go to the towel again.
There you go.
So this one's a little more complicated.
So again, when we're twisting, we're not cranking. We're not
No.
doing the thing where we're trying to make the neck
Pain-free.
crack. Fingertips, just fingertips is all you need.
So again, we're going back to the towel. Again, I like to use the selfage on this one, the little ridge on there. So you're going to take the towel and put it in this position here, right below the ears. Now here is where you switch. You're going to take arms and switch them. And the direction you're going to, I'm going to go this way. That is pulled down. Don't go across like this. You're going to choke yourself. You pull it down. And this one goes, and you're going to pull it across like this.
You'll see, I'm not doing the selfage method. I'm doing the towel roll. Everything is the same except for it rolls around here. You can try either direction, either way, and see which.
Yeah, if
is
you want to try
successful.
Brad's, his is specific to a joint. Mine is actually specific to a joint.
Right.
And we're trying to go and stay under the ears. This part angles up kind of to the eye level. and Brad's, as you can see, the same way. So try to keep this shoulder back. Don't go around like this with the
Right.
shoulder. Sometimes we even have people hook it on a chair,
Right.
like that, and pull it across like that.
Make sure you're going across the jawbone, up across the jawbone, because if you go below it, then, you know, it's hard to breathe, and that's not acceptable.
Yep, again, I'm pulling down, going across the jawbone, not going across around the neck like that. All right, if you're having, this is what I always like to do, is that make sure that if you're having pain like on this side, especially if it runs down a little bit into the arm maybe, you might try a chin tuck. So we're doing a chin tuck, and then you're going to bend to that side. Chin tuck and bend to that side. Chin tuck, bend to the side. This is the one that works for me, Brad. This is my magic one. This is the one, whenever I start having neck pain, I do this one, and in a day or two, it's gone.
Sure.
It's just,
yep.
And the reason is because I tend to do my notes. I'm like this. So, and most people tend to tilt their head one way.
Right.
And so if you do that, you definitely want to work on going the opposite direction. And you can probably see I'm tight this way. I can go that way. This one I start,
Yeah,
I
you
start
can feel that.
restriction.
Yep.
Yeah. So, all right, what else we have left, Brad? Just kind of a general one you can try. Sometimes is you can take your fist and you flip it so the thumb is actually down. And you put it underneath your head and you can pull it forward. This is good for a stiff neck. So I'm giving he gives just a gentle pressure on the back of the head and gives a little bit of stretch. Kind of gaps the joints a little bit. Be careful on this one because you can put a lot of pressure on your neck with this and without even knowing it.
So up here, fingertips is all you need. You don't have to grab and pull. It's just fingertips.
And the last one, Brad, I was going to show one of. The last
Posture.
one is, again, the wall angels against the wall, Brad. You got to make sure we have one for posture. So you're going to get your arms, and you can see I'm tight. My chest is coming out more than it should.
Yeah.
I'm a little bit tight on this shoulder especially. And you're going to bring the hands up while you're trying to keep the elbows up against the wall.
Yep.
So this one, it works your strength and stretch at the same time.
Yeah, it's a classic. It's a wonderful exercise.
You could actually probably do this on the floor even, Brad. You can
well,
lay on the floor.
Yeah, it's going to be snowing pretty soon. We can make snow angels.
Yeah, you can do the real thing.
That's the whole deal of it. You know, you can have fun and promote good posture and strength at the same time.
So we try to do is give you exercise that you could do at home without equipment. I mean, everybody's got a towel, so
Right.
we hope that'll be helpful. So thanks everybody for watching.